Hey guys, Dr. Taylor Premer here with Winchester Spine and Support, assisted by our lovely CA Danielle here today. We are starting our series on temporomandibular dysfunction, so most commonly called TMJ dysfunction. So we're going to go a little bit over the anatomy today, the assessment of kind of what we look for and what indicates that we have a TMJ patient, and then also the most common causes. And then afterwards, stay tuned for the rest of the week where we'll actually go into specifics on those different causes and how we kind of address them case by case. So the first thing is just the anatomy. So the TMJ joint is one of the most unstable joints in our body, which means that it's very susceptible to injury. If we have any type of injury, car accidents are one of our big things that we see it with. Football injuries, concussions, anything where there's kind of trauma to the head can usually manifest itself into the jaw. If you kind of take a look in here, it's a very small joint, but there's lots of different muscles and ligaments and stuff that kind of attach in here that if the symmetry and the synchronization of those muscles aren't perfect, man, it can cause a whole list of different dysfunctions. So usually what happens is that the muscles of mastication or the muscles of chewing are the ones that we find the trigger points in that kind of reproduce the symptoms of headaches, weird joint pains, even sometimes earaches that seem like an ear infection but just won't go away can actually be caused by a referral from the actual muscles or the joint itself. So our assessment is really, it's very thorough where we're looking for whether or not, number one, is it coming from the actual joint itself? Number two, is it some sort of motor pattern where maybe the brain's just not controlling the jaw correctly as it's opening and closing? Or number three, is it a referral from the soft tissue? So if we walk over here to our trusty little poster here, Travell and Simmons, our trigger point chart, this whole top chart is, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 muscles that basically refer pain up into the area of the jaw. So these are all muscles that we're palpating, that we're trying to find whether or not we can find a trigger point that reproduces your symptoms, number one, and then number two, why it's there in the first place. So because of that, it takes a little bit of time. It takes a thorough assessment to find that. So on to our next causes. So we already talked about trauma, right? If we're post-car accident, football players with their head injuries, any types of sports that involve trauma to the head. Number two is going to be habitual. So the number one reason we see it in here is clenching. So most people aren't aware that they clench during the day until we kind of point it out or we let them know that they're doing that. Some people are night clenchers, all sorts of things like that. Usually, if someone clenches at night, it's almost 100% that they're going to clench during the day. So our ultimate goal is to bring awareness to that and try to help break the habit in those terms. And then the last cause that we see a lot is food sensitivities. So for whatever reason, sensitivities in food kind of mess up our gut biome and then can put tension in areas, usually in the form of anxiety, which forms tension in the areas of the jaw, which causes a lot of complaints. So if number one, we can't address it with the soft tissues, we can't address it with our manual manipulation or regrooving the motor pattern or the way that the jaw is moving open and closed, then we're always usually going to run some sort of lab that's going to find out what exactly is going on. So if you have notice any headaches, if you notice any popping or clicking as you open your mouth or as you chew your food, or if you have a hard time sometimes getting your jaw open, if it kind of feels like it's closed lock, you'd be a prime candidate for a thorough assessment of the TMJ joint, and we'd love to help you out. So if you have any questions, let us know, but stay tuned as we're going to go through just more in depth on those three causes. So how we affect the soft tissues, our favorite treatments for that, what it kind of looks like. Number two, how habitual change can have long-lasting effects on patients with headaches. And then number three, how food sensitivities can kind of play into the TMJ assessment. So stay tuned. If you guys have any questions, the office number is 636-356-5557, or just stay tuned here on Facebook and social media. All right, thanks guys.